They told her to stop. The patient's brain activity was minimal. The vitals were failing. The trauma was too severe. 3 senior doctors stood in that remote Australian hospital room and made the call. Withdraw life support. Let him go peacefully. It's over. But Nurse Erica Reyes, a 34-year-old Filipino who had survived typhoons, brownouts, and overcrowded emergency rooms in Manila, looked at the monitors, then at the patient, then back at the doctors and said 2 words that would change everything. Not yet. This is the story of how one Filipino nurse, armed with nothing but instinct, experience, and a stubborn refusal to give up, brought a man back from the edge of death when the entire medical system had already written him off. Let's start from the moment everything went wrong. Erica had been working at a small regional hospital in rural New South Wales for 2 years. It wasn't glamorous. The hospital was understaffed, underfunded, and hours away from any major city. But it served miners, farmers, and truck drivers, people who worked hard, lived tough, and sometimes paid the price. On a scorching January afternoon, an emergency call came in. A mining accident. A 52-year-old man named Daniel Crawford had been trapped underground when part of a shaft collapsed. By the time rescue crews pulled him out, he had been without oxygen for nearly 8 minutes. His chest was crushed, his skull fractured, his body was shutting down. The helicopter rushed him to Erica's hospital, the closest facility with an ICU. By the time he arrived, his heart had stopped twice. Medics had revived him both times, but barely. Drive, Harrison, the senior emergency physician, worked frantically. They intubated Daniel, stabilized his spine, pumped him full of medications. But the scans told a brutal story. Severe brain swelling, internal bleeding, multi-organ trauma. Even if his body survived, his brain might not. By hour 6, Daniel was on full life support. Machines breathed for him. Machines pumped his heart. Machines filtered his blood. And the numbers kept dropping. Dr. Harrison called a meeting with 2 other doctors in the ICU, Dr. Patel, the trauma surgeon, and Dr. Kim, a neurologist. Erica stood quietly in the corner, monitoring Daniel's reliance. She had been with him since he arrived, adjusting doses, suctioning his airway, checking his pupils every 15 minutes. Drive. Harrison spoke first, exhaustion heavy in his voice. Gentlemen, I don't think there's anything more we can do. His GCS is 3, pupils fixed and dilated. Brain swelling isn't responding to medication. Even if we keep him alive mechanically, the likelihood of meaningful recovery is virtually 0. Drive. Patel nodded grimly. I agree. We've done everything by protocol. His family needs to be prepared, Doctor. Kim added, I've seen cases like this. The kindest thing we can do now is let him go with dignity. Erica's hand tightened on the edge of the bed. She had been listening, saying nothing, but something gnawed at her. Something didn't sit right. Doctor, she said quietly. Doctor. Harrison looked up, surprised. Yes, Nurse Reyes. His pupils, she said. 15 minutes ago, the left one reacted. Just a flicker, less than a millimeter. But it moved, Doctor. Harrison frowned. I checked them myself an hour ago. They were fixed. I know, Doctor. But they're not completely fixed now. I've been checking every 15 minutes like protocol says. There's something still there. Dr. Kim shook his head. Nurse, a minimal pupil response at this stage doesn't indicate consciousness. It could be a reflex, a dying neuron firing randomly. It doesn't change the prognosis. Erica met his eyes. With respect, Doctor. I've seen dying patients. I worked in PGH during Ondor. I've seen what nothing left looks like. This man still has something. I can feel it. Drive, Harrison sighed. Erica, I understand you want to help, but we can't base medical decisions on feelings. The data is clear. We're going to speak with his wife and recommend withdrawal of care. Give me 24 hours, Erica said suddenly. The doctors stared at her. Just 24 hours, she repeated, voice steadier now. Let me try everything I know. If there's no change, I won't argue. But if there's even a chance, don't we owe him that, Doctor? Patel frowned. Try what exactly? We've already done everything medically indicated. Erica hesitated. What she wanted to say sounded unscientific, unproven. But it was real. In the Philippines, we don't just treat the body. We treat the person. We talk to them, touch them, remind them they're not alone. Sometimes that makes the difference, Doctor. Kim almost laughed. You're talking about bedside presence as a treatment. I'm talking about not giving up when someone might still be fighting, Erica said quietly. Drive. Harrison looked at her for a long moment. Then he glanced at the monitors. Then back at her. 24 hours, he said finally. But I'm documenting this. If his condition worsens, we pull support immediately. Understood. Understood, Erica said. The doctors left, and Erica began. She started with the basics. She repositioned Daniel every 2 hours to prevent bed sores and improve circulation. She suctioned his airway meticulously, ensuring no blockages. She adjusted his fluids based on urine output, something the protocol allowed but few nurses did manually anymore. But then she did something else. Something she had learned not in textbooks, but in the chaotic wards of Manila, where machines broke and all you had were your hands and your heart. She talked to him, Mr. Crawford, she said, leaning close to his ear. My name is Erica. I'm your nurse. I know you can't respond right now, but I need you to listen. Your body is hurt, but you're still here. You're still fighting. I'm going to help you fight. She described everything she was doing. I'm adjusting your oxygen now. You're going to feel the air pressure change. It's okay. I'm checking your hands, they're warm. That's good. Your heart is strong. It's beating. You're here. Every hour. She played music softly from her phone, classical. Gentle. Nothing jarring. She had read studies showing coma patients sometimes responded to auditory stimulation. She massaged his hands and feet, stimulating nerve pathways. She opened the blinds so morning light touched his face. And she prayed, not loud. Just whispered words between tasks. Lord, if he's meant to stay, let him stay. Give me the wisdom to see what others missed. 12 hours passed. Daniel's vitals remained flat. No improvement. The doctors checked in, faces doubtful. But Erica noticed something. His temperature had stabilized. The slight rhythmia in his heartbeat had smoothed. Tiny things. Things a machine might not flag. But she saw them. At R16, she leaned close again. Mr. Crawford, if you can hear me, I need you to try, just try. Move a finger, blink, anything. Your wife is coming soon. She needs to see you're still here. Nothing. She sighed, adjusted his blanket, and stepped back. Maybe the doctors were right. Maybe she was holding on to false hope. But as she turned to update his chart, she heard it. A soft sound, a groan. Barely audible. She spun round. Daniel's mouth had moved. Just slightly. His jaw twitching. Her heart raced. Double quotes Crawford. Can you hear me? Another groan. Louder this time. She grabbed a pen light, checked his pupils. The left one constricted. Not much. But it moved. For real this time. She had the call button. I need doctor. Harrison in ICU now. Within minutes, the team was back. Doctor. Harrison examined Daniel, disbelief dawning on his face. His GCS just went from 3 to 5. He's responding to pain stimuli. Doctor. Kim checked the neuro responses. There's motor reaction in his right hand. This is... I don't understand. 6 hours ago, he was nearly brain dead. Drive. Patel looked at Erica. What did you do? I didn't give up, she said simply. Over the next 8 hours, Daniel's condition improved steadily. Swelling in his brain began to reduce. His oxygen levels rose. By hour 30, he squeezed Erica's hand on command. By hour 40, his eyes fluttered open. When his wife arrived, she found her husband awake, weak, confused, but alive. She collapsed into Erica's arms, sobbing. They told me he was gone. They told me to say goodbye. Erica held her gently. He wasn't ready to go, ma'am. He just needed someone to wait for him. Drive. Harrison pulled Erica aside later that evening. I owe you an apology. I've been practicing medicine for 20 years. I thought I'd seen everything. But you saw something we did in single quotes T. How? Erica thought for a moment. In the Philippines, we don't have the luxury of giving up. Doctor, we learn to see hope in places others call hopeless. It's not magic. It's just refusing to stop looking. Doctor. Harrison nodded slowly. I'm recommending you for a commendation. What you did was extraordinary. Erica shook her head. I just did my job, doctor. The way my mentors taught me. The way we do it back home. Weeks later, Daniel walked out of the hospital with a cane and a bright smile. His recovery stunned neurologists. News outlets covered the story. Minor survives against all odds thanks to nurses' instinct. But for Erica, the real moment came when Daniel hugged her at the hospital exit. I heard you, he whispered. Every word. I was trying so hard to come back. And you didn't let me give up. She smiled. We don't give up on people. Crawford. Not while they're still fighting. The hospital administration took notice. They invited Erica to lead a training program on patient-centered care in critical settings. Other nurses came from across Australia to learn, and Erica taught them not just protocols but presence. Not just medicine but hope. So the next time someone says a case is hopeless, that the numbers don't lie, that it's time to let go, remember Erica Reyes. Remember that sometimes the most powerful tool in medicine isn't a machine. It's a human heart that refuses to stop believing. And if you're ever that patient, lying silent and afraid, holding on by a thread, pray that your nurse learned the care not in a textbook, but in a place where hope is all you have. Pray for a Filipino nurse who knows how to see life where others see endings, because they don't. Just save lives. They refuse to let them go.